Your heart needs to be strong to keep up. Flora for a strong heart today. Statistics paint a clear picture that women are not looking after the health of their hearts. Dr. Riaz Motara is a cardiologist with a special interest in preventative cardiac care and runs the first private clinic in South Africa devoted to women's heart health.
Women most certainly do suffer from heart disease. In fact, since 1984, more women die of heart attacks than men do. Now, traditionally, most women believe that only men suffer from heart attacks, and in fact, most doctors believe that men suffer from heart attacks. But since 1984, heart disease kills more women than men.
Women often underestimate the severity and effects of cardiac concerns and don't wish to worry their families. This can have devastating consequences.
All female cancers put together only account for 4% of deaths in women. Heart disease accounts for 48% of deaths in women. Most women will go to the gynecologist and have a checkup and have a mammogram, have a pap smear, have a bone density scan, but very few women have their hearts assessed.
Women often don't have the same symptoms of a heart attack as men do, which can lead to misdiagnosis. Joan Sarlie knows this can be true from first-hand experience.
Going to a normal funeral, I then felt jaw pains, and I thought, where does this pain come from? Got some ice blocks, tried to keep it cool, went home. After that, I went to go and see a doctor. Went to numerous doctors, but none of them could detect that this could have been a heart problem. Eventually, I was then referred to the cardiologist. Came to Dr. Motara, and Dr. Motara was quite surprised that he felt that many doctors don't know the heart attack symptoms. And that is where my heart attack came from.
Simple things like regular blood pressure screenings and cholesterol tests can go a long way to preventing serious heart disease. Women should be aware of their risk factors for their cardiac wellness, which range from genetics to hormones and unhealthy lifestyle.
By far the commonest risk factor that gives women a high risk of developing a heart attack is smoking. So 50% of heart attacks that women have is a consequence of smoking. High blood pressure, high cholesterol, diabetes, a strong family history, and then there are certain hormonal problems that also put patients, or women specifically, at a higher risk of developing heart attack. So an underactive thyroid, high homocysteine levels, which is a waste product in the body, the menopause, all put women at a higher risk of developing heart attacks.
Recognizing a heart attack in a woman can be difficult, even for an experienced medical professional. Dr. Motara explains some of the differences in the symptoms.
Most women will present with pain either in the jaw, in the neck, in the shoulders, or in the upper abdomen. They also present typically with symptoms of nausea, or vomiting, indigestion, chronic fatigue, and a burning sensation over the tummy area, as compared to men that have pain over the central part of their chest. So if women experience any of those symptoms, the easiest thing to do is to go to their doctor and have an ECG done.
If you're concerned about your heart health, it's better to seek medical help sooner rather than later. Dr. Motara has some suggestions to keep your heart healthy.
In terms of the preventative measures that reduce the risk of heart disease, then walking for 30 minutes a day, 5 times a week, reduces your risk of having a heart attack by 50%. Eating a low glycemic index, low-fat diet also reduces your risk significantly of developing heart disease. If you have a strong family history, then make sure you get assessed earlier. If you smoke, then stop smoking immediately.
Small lifestyle changes which are easy to implement and maintain can have great long-term effects in lowering your risk of heart disease.
You've got to find a medium of doing things, at least, as doctor says, everything in moderation. Don't overeat, don't overdrink, don't smoke, and you would have a healthier life then.
Your heart needs to be strong to keep up. Flora for a strong heart today.